All right, it's time now for your weekend wellness. And this week, we're focusing on a new study on the dangers of smoking excessive marijuana. A Canadian study found that 9% of those who use marijuana excessively develop schizophrenia, compared to just 0.6% for those who don't. And here to unpack it all is Fox News medical contributor, Dr. Nicole Saphier. Nicole, I have always been on the side of not legalizing, and the reason marijuana use, and the reason is my husband was a prosecutor, and he dealt with a lot of, these groups that were trying to help rehabilitate people on drugs, and they always told him, this was before we saw the legalization, please don't legalize, please don't allow, your party to get behind legalization, because it's a gateway drug to other drugs. But you're saying there's also other impacts on just your mental health.
Well, that's right, Rachel. So first of all, it's important to recognize that there are some benefits for marijuana, specifically medical benefits, when it comes to glaucoma, pain, appetite stimulate, and even has some benefit with multiple sclerosis and in cancer patients. However, I have also, like you, have been very cautious about legalization of marijuana because there are known risks with it. And this large population-based study out of Canada, looking at over 13 million people in the province of Ontario, is showing that there is nearly a 15 times risk associated with schizophrenia with cannabis use disorder. Now, this is not surprising because we have already been well documented of the risk of other psychoses when it comes to cannabis use. They also can negatively affect your heart, your lungs, your metabolic system. It can also increase your breast tissue and causing an increased risk of breast cancer, and you can see decreased sperm count and fertility with it. So it is very concerning when it comes to people using this a lot more, and you're seeing rising levels of THC over the years in marijuana that people are using. Now, when you ask people, why are you using marijuana, a lot of people say, well, I have anxiety, or I just want to relax myself. Well, let me tell you, not everything that is natural is good for you. So you should always talk to your doctor before you use it, but I can tell you there are far safer other herbs that I like that are natural that can help with relaxation. And some of those are like lavender, chamomile, low-dose kava kava. You can also use herbs that are good for your brain like ginkgo biloba, ginseng, bacopa monnieri. These are all things that are also natural, also have a much more safer risk profile. So if you're trying to just kind of calm yourself or increase your brain health, I would focus on those and still talk to your doctor about it. But personally, I have always been a little concerned about the rising use of cannabis because of the negative effects of it.
I have been a lot concerned about its normalization. And you and I know, I mean, let's just be honest. We're moms. We were also teenagers. We knew those potheads in high school. They're lazy. Why would we want to normalize this when we see the effects on that? Plus, we know that it can really just disrupt your motivation for life and get you hooked on something instead of motivated to have a better life.
Yeah, it sure can. And it's not just laziness. It really does kind of dampen the person's mood, and it can lead them to, as you had mentioned, a gateway drug. Now, there's conflicting research as to whether this leads to hardcore drug use in the future, but it is certainly a form of addiction. And our children are already suffering with a lot of addictions, even social media. Like, why would we continue to promote this? Why wouldn't we want something that's going to be motivating them instead of like dampening their response? And especially with this clear association of psychoses. And the Canada study actually mirrors what we saw in a Denmark study too, over twice the rate of schizophrenia with cannabis use. I mean, it's a no-no, and I certainly don't recommend this unless it is very specific medical conditions that are proven to benefit from it. But general use, I don't think so.
I miss the just say no days. I really do. Thank you, Dr. Saphier. Always great having you on. How about getting high on life?
Thanks so much.